Hi everyone, today I'm going to be talking to you about a commonly faced ethical dilemma within therapy, and that is treating a patient who is inappropriate to receive services. So this specific patient is a spinal surgery patient, and he's transferred from the floor to the rehab floor of a hospital. He's a total assist and requires 2 to 3 persons to transfer, and that includes the use of a sliding board. The patient is in extreme pain through his back, abdomen, and legs, and the pain is essentially debilitating the patient, so much so that he's unable to participate in therapy and often refuses the sessions. If he does agree to participate in therapy, his sessions are typically bed-bound. Therefore, the patient is inappropriate for the high intensity of inpatient rehab, but the surgeon who did this man's specific procedure does not send his patients to skilled nursing facilities. Therefore, the inpatient rehab floor of the hospital is forced to treat him. So when you break this situation down into reasons that it is unethical, the first reason or the first component of being unethical is that the patient is not appropriate for therapy, but he's still being treated. Another reason that this situation is unethical is because the patient is occupying a bed on the rehab floor, so someone who could actually benefit from therapy is not receiving the service. And lastly, in order to keep the patient on the rehab floor, the therapist must be incorrectly justifying the patient's reason to stay and his need for therapy. Some solutions to help with this situation would be that the therapist stops treating the patient is discharged from inpatient rehab, or the therapist correctly documents that the patient will not gain from therapy and that he is not appropriate to receive services. This is necessary, and this is a responsibility of the therapist because the therapist is providing unnecessary services that does not benefit the patient, and it is in the OT Code of Ethics to provide justice to all patients. So therefore, we are responsible to provide services only that are needed, and that includes services where the patient has the potential to show gains. Therefore, the therapist is liable for the patient's health. Another responsibility of the therapist is providing services that people need in order to adequately recover. So allowing an inappropriate patient to occupy a bed that could benefit the well-being of someone else is denying those other patients the right to receive treatment. And lastly, the therapist is responsible for billing services in both a legal and a just manner. The therapist is responsible for documentation and ensuring that this documentation and reimbursement is done according to laws and regulations, whether that be OT in general or specific to the unique facility that they're working at. So relating this scenario to what I would do, first I would state my concern for continuation of treating this patient. I would voice this concern to the other therapists on the team that I'm working with, as well as the treating physician who is signing and putting in the patient's orders, and the case manager to discuss other potentials for this patient. I would bring attention to the fact that the facility has a waiting list of other patients who are downstairs waiting to be moved up to this rehab floor, and because this patient is inappropriate for therapy, he is prohibiting patients to get therapy that they could actually benefit from. And lastly, I would document and note within my documentations that this patient is indeed not appropriate for this high level of therapy, and I would suggest a different therapy service such as that from a skilled nursing facility. And I would not justify this man's length of stay, but rather state that there is no potential for gains. Therefore, this situation is no longer in my hand, but it becomes an issue for the physician to deal with, because he would therefore have to justify the needs of the patient instead of me doing it unethically.